Hi, and welcome everyone. We'll give everyone a few moments to join, and then we'll go ahead and get started. All right, I'm sure some people will continue to trickle in, but we can go ahead and kick things off. Hello, I'm Whitney Christopher. On behalf of Elysium Health, I'm thrilled to welcome you to today's webinar on healthy skin, what it does, how it ages, and how to care for it. It seems fitting that we're picking up Elysium's webinar series in September because school is definitely in session today, and you're in for a real treat with information everyone can use to support healthy skin at any age. As some of you know, I lead a number of divisions in my role at Elysium Health, including scientific communications, and it is one of the best parts of my job because it involves working closely with Elysium's accomplished science team and our renowned scientific advisory board, which includes today's speaker, Dr. Richard Granstein, or as we are privileged to know him here at Elysium, Rick. As Dr. Granstein will share today, our skin is not only our largest organ, but it's also unique in its visibility. Everyone can see our skin and its vulnerability to internal and external stressors like sun exposure. When we were developing our skin-focused product, Mosaic, with Dr. Granstein's advisement, we at Elysium learned a lot about skin, including that it's really, really good at what it does, protecting us from the outside world. So I'm very excited for you to have the opportunity today to learn directly from Rick. In a moment, I'll be turning it over to Dr. Granstein, who, as I mentioned, we worked with to develop Mosaic, which addresses skin aging from the inside and helps to preserve collagen. Since Mosaic launched nearly 2 years ago, it received rave reviews from both doctors and top publications, including Forbes, Harper's Bazaar, Robb Report, Town and Country, among many others. Dr. Granstein is an internationally recognized specialist and thought leader in dermatology and has been the chair of dermatology at a leading academic institute here in New York for more than 30 years. His research programs focus on how the nervous system regulates immunity in the skin. And fascinatingly, Dr. Granstein was the very first to demonstrate that certain immune cells within the skin are capable of initiating an immune response against a malignant tumor. Wow. In 2017, Dr. Granstein received the Award of Excellence from the Association for Psychoneurocutaneous, say that 5 times fast, Medicine of North America. He sits on the Education Council for the American Skin Association and serves as chairman of the Medical Advisory Board for the National Rosacea Society. Before I turn it over to Dr. Granstein to start his presentation, one small bit of administrative housekeeping. As is our usual format, we'll be accepting questions throughout the webinar that Dr. Granstein will answer later in follow-up content that we'll share across Elysium social media channels and our newsletters. So please submit your questions as they come to you. And don't worry if you can't think of anything today or if something comes to you later. We'll send an email after the webinar so you can submit questions then. And I'll also include the email address to reach out to us at the end of the webinar. So without further ado, it is my distinct pleasure to welcome Dr. Granstein for what I'm sure will be a skin deep presentation. Dr. Granstein.
Well, Whitney, thank you very much. And I want to thank everybody who is watching this. It's always a great pleasure to talk about the skin, one of my favorite things to do, and of course, my favorite organ. Um, so I'm going to spend a few minutes talking about the skin, what it does, some of the things that can go wrong, what we can do to prevent some of the things from going wrong, and what we can fix after certain types of damage to the skin. So I'd like to start just by talking about, or asking the question really, why do we have skin? As you can see, skin comes in all sorts of colors and shades and different appearances, but it really does a whole host of very important things for us to help us survive and to help us experience the world. Many people who are not dermatologists think of the skin as sort of a layer of saran wrap or aluminum foil, keeps the outside out and the inside in, and leave it at that. But I hope I can convince you over the next few minutes that the skin is really a wonderfully complex and important organ, subserving a whole host of necessary and key functions. Now, this is an artist's representation of the skin, and I'm showing this to point out that far from being just a layer of saran wrap protecting the body, you can see that it's a wonderfully complex organ. The upper part is known as the epidermis, and you can see this here. This forms a layer called the stratum corneum, which is the very top, sort of the dead layer. And this is something which is very important in terms of the barrier function of the skin. Below that is the dermis. This is a collagen-rich layer, which provides a lot of the structure and strength to the skin. And in terms of the skin aging, there are changes here that are very important. There also are changes in the epidermis. Below that is the hypodermis, or the layer of fat. There's a layer of fat tissue underneath most of the skin, almost the entire skin, although not the entire skin surface. In addition, you can see there are other things. There are hair follicles, there are sweat glands, there are nerves, there are blood vessels. So there are a lot of subunits to the skin, appendages to the skin that are very, very important. So the hair and nails are really part of the skin, and we'll talk about that in a little bit. So, what does the skin really do for us? Well, it does a number of very, very important things, as I've already said. So, and on the lower left here is what a pathologist would see looking at a small section of normal skin that has been stained appropriately. And again, you can see the epidermis, the stratum corneum, that dead layer I had talked about, and here is the dermis. So, what does the skin do? Well, it certainly does have very, very important barrier functions. Why do we need this barrier? Well, it keeps microorganisms out of the body, prevents them from causing an infection. It regulates fluid and electrolytes so that we don't dry out and we keep the right balance of electrolytes like sodium and potassium and acetic chloride in our bodies. And it keeps toxins out also. Another really important part of the protective functions of the skin are its immunologic functions. Again, our immune system can deal with microorganisms entering the skin and protect us from infection. And interestingly, the immunologic functions of the skin and the immunologic functions generally help protect us against skin cancer. And I'll talk more about that later on. A third thing that the skin does in terms of its protective functions is wound healing. When the skin has an opening, when you cut yourself or something happens and there's a wound in the skin, within an hour or so, you can detect the epidermis, that upper layer, starting to heal because it wants to go and close that so that microorganisms and other outside influences cannot enter the body. Another thing it does in terms of protection is protecting against ultraviolet radiation. As is well known, ultraviolet radiation is the primary cause of cancer in the skin. And so we'll talk in great detail about that. Ultraviolet radiation is also the main external influence causing what we recognize as aging of the skin. And I'll talk about that later also. So the skin has mechanisms to protect against ultraviolet radiation's bad effects. These include melanin, which is the brown pigment, the pigment that gives our skin color. There actually are two types of melanin, eumelanin, which is more protective, and pheomelanin, which gives hair and skin a reddish tint. which is less protective or perhaps not protective at all. But to talk about the two types of melanin, I think in detail is beyond the scope of this talk. Um, but melanin protects us against ultraviolet radiation. And as you know, we can have a tanning response, which is one of the ways that the skin tries to protect itself when it is experiencing ultraviolet radiation. The stratum corneum, that dead layer that I was talking about, also provides some protection against ultraviolet radiation. And the skin also has a lot of antioxidants in it. So why is that important? Ultraviolet radiation, and again, I'm going to speak about the various types of ultraviolet radiation later, but both UVB radiation and UVA radiation can generate radical oxygen species. These are molecules that become reactive when they've absorbed photons of the appropriate wavelength, and they have to react with something. And if they react with proteins or DNA or RNA, they can do damage. But antioxidants will allow them to more safely quench quench these molecules so that they don't react with proteins or nucleic acids, and the energy in those molecules is disseminated safely. Melanin, by the way, in addition to being a neutral filter against light and against ultraviolet radiation, also is a pretty good antioxidant. Another thing that the skin does is to protect us against mechanical forces. And this is mostly, but not entirely, through the strength of the dermis. It resists shear forces, it resists cutting to a degree, and it cushions against blunt blows. Now, moving on to something else that the skin does, which is not purely protective, although partially protective, is sensation. Imagine a world where you couldn't feel anything. Uh, you wouldn't know if something painful, if you rested your hand on a hot plate or on a knife. If you had no sensation, you wouldn't know that. So the sensation is protective. It also allows us to experience the world through touch, pressure, vibration, temperature. So sensation is, of course, a very, very important part of what the skin does for us. Now, I had mentioned that hair is also part of the skin, grows out of the skin. Um, Hair plays a role in sensation also. Hair bulbs, the place where the hair is growing from in the skin, is surrounded by nerves. And in fact, if you rub your hand against the little what we call vellus hairs, little hairs on much of the body, on the hands and the arms, it tickles a little bit. And this is protective. So if there's an insect on our skin, it'll bend the hair and we'll feel it, brush it off. Hair is also important for temperature regulation, particularly in lower animals. Excuse me, but even in humans, the head is about 9% of the body surface area, and some people think hair plays a role in temperature regulation in people. Obviously not important compared to lower animals. It also protects the eyes, ears, and nose. We have eyebrows and eyelashes to protect against things getting into our eyes. Hair in the ears and nose will alert us when something is, again, trying to enter these places. So it is protective. Why do we have hair in the groin or under the arms? Well, it serves as a dry lubricant so that skin doesn't rub against skin and become chafed or damaged. So hair has some functions other than just looking good, but it also is important part of how we feel about ourselves and how we want other people to perceive us. So it also is important in communication. Nails. When I ask people what nails are for, a lot of people will say, well, it's an organ of protection, and they imagine a cat scratching or a tiger or something. In humans, it's not very good as an organ of protection, but it gives mechanical stability to the soft tissue at the end of the fingers. And people that don't have nails have a great deal of difficulty manipulating small objects. So the nails are very important in terms of allowing us to use our hands effectively with small objects by providing this mechanical stability. Now, what else does the skin do? Well, of course, thermoregulation. It helps to maintain our body temperature where it needs to be for our bodies to function properly. We become cooled when we sweat. When we sweat in a hot environment, water is deposited on the outside of the skin. And when that water evaporates, it removes the heat of enthalpy and it cools us. The phase change from liquid to gas uses a lot of energy. Um, also, the skin can radiate heat away by the amount of blood that is in the skin. So blood vessels, excuse me, within the skin will dilate. And when it's hot, you'll get more blood in the skin and heat can radiate away. Conversely, when it's cold, the blood vessels will constrict and you get less blood going to the skin, less radiation of heat away from the body to keep us warm. Now, beneath the skin, as I'd mentioned, is this layer of subcutaneous fat. Not really part of the skin in a way, but what is it for? Well, it separates the skin from the underlying body constituents. It's a layer of insulation. It's a source of high energy molecules. It also provides some mechanical protection. And importantly, it is the substrate that carries blood vessels and nerves to the skin. So something else that is quite important for us. Now, I had mentioned that communication is important, and it's important in a number of ways. It's important in sending messages non-verbally to others, and it also, again, it allows us to make ourselves look the way we want to. It's important for our self-image and also the image projected to others. Now, some people say, oh, that's ridiculous, but of course it's not ridiculous. As it says here, we spend $425 billion on cosmetic problems sorry, cosmetic products to make ourselves look the way we want people to look so that people will recognize us the way we want them to. We spend a lot of money on hair, on curling hair and straightening hair and coloring hair and on makeup and also on cosmetic procedures to alter the way the skin looks on our face. So clearly, that type of communication is a very important function of the skin. Now, also, how is it that we communicate messages? Well, we can do that by smiling. People know what that means, or frowning, or looking angry. And interestingly, that type of communication, some of it is hardwired. It's not learned behavior. And that's why I'm showing this picture of a baby. You can see the baby smiling and the baby making other facial expressions. This wasn't learned. These babies didn't have hadn't been alive long enough to learn these. So this is hardwired. This is inbred in us, some of these. Babies soon after birth will smile appropriately. So now I want to change tacks a little bit and talk about sunlight and the skin. And, dermatologists are always talking about the sun and stay out of it and wear sunscreen. Why do we do this? Let's talk about it. Well, sunlight has some benefits, right? It increases vitamin D. There's evidence that it may decrease blood pressure, and it certainly elevates the mood. When people are feeling blue, they go in the sun and often feel better. And we talk about a dark day as a gloomy day, don't we? Um, so it does this. Something that's maybe related to this, I think is kind of interesting, is why do people like to lie in the sun? Why do so many people like to go outdoors and just lie in the sun? Well, it turns out that ultraviolet light and sunlight causes the skin to release a class of compounds related to opioids. So we get a little bit of an opioid high by laying in the sun. These are called endorphins, and maybe that's why sunlight makes us feel better and why we want to lay in the sun, or at least many people do. But unfortunately, chronic and repetitive exposure to sunlight can cause some problems. Well, even acute sunlight exposure can cause sunburn. But skin cancer and skin aging are unfortunately effects of chronic and repetitive sunlight exposure. And there's no question about that. Now, what are we talking about when we talk about ultraviolet radiation? So ultraviolet radiation is part of the electromagnetic spectrum. And as you can see, the ultraviolet spectrum is longer wavelengths than X-rays and gamma rays, and shorter wavelengths than visible light. So the ultraviolet spectrum is divided somewhat arbitrarily, but also based on biological effects. Whoops, sorry about that. Into UVC radiation, UVB, and UVA. UVC radiation is made up of fairly high energy photons, but fortunately there is almost no UVC radiation, or there is no UVC radiation at the terrestrial surface except from industrial sources. It doesn't, the ozone layer totally blocks it, and in fact, UVC radiation doesn't even penetrate very far through ordinary air. Slightly longer wavelengths is the UVB range, and probably most, if not everybody listening, has heard of UVB radiation. This is the waveband which is most responsible for the acute effects, the sunburn effects of sunlight, and also are the most carcinogenic, or is the most carcinogenic portion of the ultraviolet spectrum, causes skin cancer. UVA radiation is still longer wavelengths, and there's a lot of UVA radiation. The most abundant part of the most abundant type of ultraviolet radiation at the terrestrial surface is UVA. But it does contribute to skin cancer, but it is much less effective than UVB in terms of that. It does, however, significantly play a role in aging of the skin, and we'll talk about that later. I'll also just mention that the UVA band is itself subdivided into UVA1 and UVA2, again, based a little bit on their different biological functions. And UVA1 actually is sometimes used therapeutically for certain skin conditions, but again, I'm not going to discuss that today. So what are some of the acute effects? Well, sunburn, obviously. I think probably most, if not all of us, have experienced this. Obviously not a good thing, and very common though. What about chronic effects? Well, we have, as I mentioned, the chronic effects are skin cancer and skin aging that we need to talk about. I actually like this photo here very much. I call it two carcinogens in one. You've got the sun there, which is clearly a carcinogen for the skin, and also a cigarette. So there are a number of different types of skin cancers. The three that are most commonly discussed are basal cell carcinoma. Basal cell carcinomas are the most common human malignancy. There are about 1.5 million every year in the United States. Fortunately, unless they're ignored for a very long time, they don't tend to metastasize or spread through the body. Metastasis is very rare, very rare. They can be locally destructive, however. They can grow into bone or muscle or into an eye, or so they must be treated. Not 100%. I mean, if someone is very elderly and there's a small one not near a vital organ, you can say, well, maybe, we can let this go. Probably the patient's lifespan is such that it won't be a problem, remaining lifespan, I should say. But most of these end up getting treated and should be. Squamous cell carcinomas, shown in the picture, one of which is shown in the picture in the middle. These are more dangerous than basal cells, but still, when they are caused by sunlight, they are less likely to behave aggressively compared to squamous cell carcinomas caused by other carcinogens, such as heavy metals or certain like chemical agents. But they are more aggressive than basal cells, and every year there are people that die from metastatic squamous cell. The most dangerous of the three is malignant melanoma. Most, although not all, melanomas are a result of sunlight or sunlight playing the major role in their occurrence. And people die of this. You can die from this. Once it is metastasized, it is very difficult to manage. Although, fortunately, the relatively new development of effective immunotherapies for melanoma has changed the landscape of stage 4 or widely metastatic melanoma. And fortunately, we can often keep people alive for quite a while. And a fairly a large, not, it's a minority, but a large minority of patients do quite well, and some appear to be cured. So the landscape is changing in terms of our dealing with metastatic melanoma. But melanoma is very dangerous, and you want to get it removed while it's still small and localized. And melanoma that has not invaded deeply into the skin is quite curable. I want to actually say a few things about what to recognize in terms of melanoma. Dermatologists talk about the A, B, C, D, E's. These are the characteristics you want to look for if you see something suspicious on your skin. A stands for asymmetry, and as you can see, one part of this looks different from another part. If you see something like this, get it checked. B stands for border. The border is irregular, scalloped. Yeah, that's also a sign that maybe possibly this could be something and it should be checked. Um, it's the border is an interesting one. It takes a little bit of judgment because nothing looks perfectly straight. And if you look at anything closely enough, you can usually see something. But if it looks suspicious, get it looked at. Multiple colors is something also that we definitely don't like to see. This picture really looks like a melanoma. You can see it has black and white and brown, maybe a bit of red. Um, this is really looking at it. I would say this is just looking at it. I would say it's most likely a melanoma, and you don't want it to get to this state. You want to get it removed before this, if at all possible. D is for diameter. Things that are larger are more likely to be problematic than things that are smaller. Um, if something is more than 6 millimeters, I don't think you have to immediately take a knife and cut it off, but certainly get it checked by someone that can effectively evaluate it. E is evolving. That's really important. Something is big, something is little and it becomes big, or even if, sorry, this is doing that, or something is large and then becomes small. These sorts of changes really need to uh, be something that says to a person, this needs to be checked. The reason why something that is large becoming small sometimes is problematic is that the immune system sometimes will recognize something that's atypical and try to destroy it. So, um, anything that changes, if it's evolving, get it checked. Okay, so how does ultraviolet radiation cause problems? Well, one of the things it can do is cause changes in DNA within cells. So photochemistry occurs. When you have photons of light, the energy in that light, when that energy is absorbed by an absorbing molecule, the energy in that photon has to be transmitted to that molecule, and something has to happen. Now, in the top box here, UVB radiation has a characteristic change in DNA forming a thymine dimer or a cyclobutane pyrimidine dimer. And these can play a role in causing mutations involved in skin cancer. Similarly, there's another type of photoproduct that occurs called a pyrimidine pyrimidone 6,4 photoproduct. This also can lead to changes, mutations that are important in the generation of skin cancer. So this is one mechanism. Another mechanism, again, is the induction of radical oxygen species, which, if not quenched by antioxidants, will also cause damage to macromolecules such as proteins and things like DNA. Here's a cartoon showing some of the things that ultraviolet light exposure does to the skin. As I mentioned, it can cause radical oxygen species. And these radical oxygen species are not only involved in contributing to cancer formation, but also aging of the skin. And importantly, these radical oxygen species, as well as other things such as interleukin 10 and TNF alpha released in the skin, can have immune suppressive effects. And it turns out that the ability of ultraviolet radiation exposure to suppress immunity within the skin is indeed important in skin cancer formation. And I'll show that more graphically in a little bit. But that is absolutely true. Ultraviolet radiation will also cause nerves in the skin to release a neuropeptide that has a funny name, calcitonin gene-related peptide, or CGRP. But CGRP also has some immunomodulatory effects that can result in immune suppression within the skin. So it's funny that we have evolved so that ultraviolet radiation causes us to be immune suppressed somewhat. And one can speculate on why this would have evolved. But one reason might be because ultraviolet radiation also damages cells in the skin with release of hidden antigens, hidden proteins that normally wouldn't see the immune system, but can be released with damage to the skin. Also, there are immunostimulatory cytokines, small proteins that are involved in inflammation that can also be released by damaged cells. And so the ability of ultraviolet light and sunlight to suppress immunity may have evolved in part so that we don't develop autoimmunity with these more stimulatory proteins being released and these hidden antigens being released. It's one theory anyway. Now, in addition to the things that I showed on the last slide, there are a whole series of molecules in the skin that are believed to play a role in this immune suppression that ultraviolet radiation can cause. I'm not going to go over these in any detail, but I have again highlighted here radical oxygen species because that's something that we can take action to try and deal with, and we'll discuss that a little bit later. Now, I had said that the immune system is really important in controlling skin cancer, and that it is believed, anyway, that the immune suppression caused by ultraviolet radiation plays a role in the development of skin cancer. That's pretty well worked out in animal models, and almost certainly is true in humans. But the idea that the immune system in any way is important for controlling skin cancers is demonstrated by the data on this slide. The patients medically, an experiment, in a way it's an experiment, not an intentional experiment. Many people have their immune system suppressed medically because they have some disease. And the most common one of the most common reasons why we have to immune suppress people is so they won't reject a transplanted organ. In any event, patients whose immune systems are suppressed have a tremendously increased risk for skin cancer. SCC, which stands for squamous cell carcinoma, depending on the study, has shown up to a 250-fold increased risk of skin cancer. Basal cells, the most common skin cancer in the general population, has about a 10-fold increase. Melanoma, that really bad tumor, has a 2 to 5-fold increase. And there's another type of cancer I didn't talk about called Merkel cell carcinoma. Merkel cells are cells we call neuroendocrine cells in the skin. Merkel cell carcinoma is pretty rare. Unfortunately, it's a serious disease. It can be fatal, often is fatal, if not found very early. Anyway, Merkel cell carcinoma is also increased, depending on the study, from 5 to 50-fold compared to the background rates. So there's no question that the immune system in some way is controlling skin cancer. Now, I've mentioned a couple of times that antioxidants are helpful, including the ones that are naturally in our skin, and as well as ones that experimentally have been either given systemically or topically to animals or to people. So antioxidants inhibit UVB radiation-induced inflammation or sunburn, again, in part mostly by inhibiting the action of radical oxygen species that are generated. There are a number of studies, some done in my laboratory, showing that antioxidants can inhibit the immunosuppressive effects of UVB radiation in experimental animals. And also, there are many or a number of antioxidants have been shown to inhibit or retard the induction and growth of skin cancers induced by UVB radiation, again, in animal models. For all these reasons, as well as the fact that these may have activity in preventing and actually even improving um, um, uh, the appearance or the reality of aged skin, antioxidants are incorporated into many skincare products. And I'm going to share some data from experiments that we had done in my laboratory recently studying pterostilbene and nicotinamide riboside. Pterostilbene is an antioxidant. Nicotinamide also has antioxidant activities and has some other very interesting activities. And we're going to talk about that. So pterostilbene, this is a polyphenol, type of plant, chemical in plants, naturally found in blueberries. It's a pretty good antioxidant. And as I mentioned, as with other antioxidants, it's been shown to protect against UVB radiation deleterious effects in animal models as well as in cells in a dish. So nicotinamide riboside, this is a vitamin B3 derivative. It's a precursor of something called nicotinamide adenine dinucleotide, which in its oxidative form has a little plus. And nicotinamide riboside, or NR, increases circulating NAD levels and has anti-inflammatory effects also. So why is NAD so important? It's a crucial coenzyme for a number of metabolic pathways. It's important for oxidation reduction reactions, which are needed for ATP production. And ATP is really involved. It's really energy. This is for energy production in our cells. And interestingly, radical oxygen species can deplete NAD, leading to low energy states in cells, and also preventing the repair of DNA photo damage in the skin. So NAD is really important. It's important for many things, not just in the skin. And I'm going to point out something very interesting. A phase 3 randomized trial found that if patients were given nicotinamide, now this isn't nicotinamide riboside, but both of them lead to higher levels of NAD, and NR is actually more efficient at doing this. But anyway, patients that were given nicotinamide who were at high risk for skin cancer had about a 23% lower incidence of non-melanoma skin cancers occurring compared to a control group. And this was really mostly squamous cell carcinomas that were suppressed. So this is very, very good evidence that in humans, things that increase NAD may be quite useful in terms of the risk of non-melanoma skin cancer. Now, in our lab, we recently asked the question whether how NR, or nicotinamide riboside, and pterostilbene would work together, or could work together, or do they work together to inhibit a sunburn response. And we didn't do this in humans, but we did this in mice, and it was really pretty interesting. So we fed them pterostilbene in food and nicotinamide riboside in water, and we did that for a few weeks, for 4 weeks, and then we exposed them to UVB radiation to produce a mild sunburn. And we measured the strength of the sunburn by looking at how thick the ears were. That is, that because of the sunburn or the exposure, the ears would get a little bit thicker. And we wanted to see whether we used that as a measure to see whether giving the nicotinamide riboside and pterostilbene orally would have an effect. And at the dose that we chose, at least for this part of the experiments, we found something very interesting. So this shows the ear swelling or sunburn responses at 24 hours and 48 hours. This bar is just having them eat normal food and drink normal water. If we gave them just the NR, the nicotinamide riboside, excuse me, there was no difference in how swollen they became. If we gave them the pterostilbene alone, again, there was no significant difference in the magnitude of the sunburn response. But when they were given together, the sunburn response was markedly reduced. So this is very interesting to show that at least at the dose that we tested, the two of these these two agents could work together to inhibit the sunburn response. Of course, we don't have data that whether this is true in humans, but it's pretty interesting. We also looked at whether nicotinamide riboside and pterostilbene could inhibit immune suppression caused by UVB radiation. And again, we did this in an animal model. The results were, again, pretty interesting. So we gave nicotinamide riboside, NR, and or pterostilbene or PT to animals, then exposed them to UVB radiation, and then immunized them to something called a hapten, which you can think of as sort of a poison ivy-like thing. So there are two ways of doing this. In some experiments, we would shine a low dose of UVB radiation on the mouse, then wait a while, and then immunize the mice to the hapten, to the poison ivy-like material, just where we exposed the site of the skin to UVB radiation. Then we wait a few days and then challenge them by painting the hapten on a non-exposed site and look for an allergic response. In other experiments, we did the same sort of thing, except we gave a higher dose of ultraviolet B radiation. And with the higher dose, we immunized them to the hapten at a non-exposed site. That's called the systemic model. And where we used low radiation and immunized them just at the site of exposure to the UVB, that's called the local model. And then again, with both models, a few days after immunization, we challenged them at a non-exposed site and measured the allergic response. And it turned out to be quite interesting. NR and PT, nicotinamide riboside and pterostilbene together, and each one alone at the doses we used, inhibited the immune suppression caused by UVB radiation in the local model. In the systemic model, NR and PT together and PT alone inhibited the immune response. NR was less effective, and there was no statistically significant decrease, although maybe there was a little bit of a trend. But this is quite interesting. So it shows that given systemically, at least in this animal model, NR and PT are able to inhibit some of the bad effects of UVB radiation, specifically its ability to cause immune suppression. So why did we do all this? Well, this is sort of a summary slide for what we've talked about skin cancer and ultraviolet radiation. Ultraviolet radiation does two things. It acts on targets within the skin to cause changes in DNA that lead to a neoplastic transformation. Every time I touch the mouse, that happens. Start inducing a cancer. But also importantly, it causes immunomodulation. It modulates the immune system. I've just talked about how it can suppress the immune system. This leads to the induction of what are called T regulatory cells, which can facilitate tumor induction, and these changes regulate tumor progression. And again, as I showed, there's excellent evidence in humans that the immune system in many ways controls the development of skin cancers. So what do we want to do to prevent this? Well, as you've probably heard too many times in the last few minutes, the major cause of skin cancer is exposure to ultraviolet radiation and sunlight. So it's simple. We should avoid excessive sun exposure and use an effective sunblock when we're in sunlight. Now, I'm not saying never, ever go outside without covering yourself with tinfoil, but be sensitive to the fact that chronic and repetitive exposures are not good for you, not good for any of us. And It is true that sunlight has some good actions. And again, I'm not saying never ever go outdoors, but use common sense. Be careful. And people that worry about vitamin D can ingest vitamin D as a supplement. Um, Also, use sun protective clothing. And perhaps very importantly is to look at your skin once in a while. And if you see anything new or changed, have a doctor look at it, preferably a dermatologist. And it doesn't hurt to have regular skin examinations by a dermatologist. I can't tell you how many times someone comes in, doesn't know they have a melanoma on their back or between their buttocks that I find. Um, so it's not a bad idea. Now, um, again, aging of the skin is something that a lot of people worry about. They worry about it for its changes in how they look, and aged skin is more likely to develop skin cancer also. So let's talk about that. So what is skin aging? Skin aging is characterized by a number of features, including wrinkles, loss of elasticity, looseness, laxity, and a rough textured appearance. I'm taking this from someone else's language, as you can see. This aging process accompanied with changes in cells that can be measured and demonstrated, as well as functional changes in extracellular matrix. What is extracellular matrix? It's the outside of the cells. It's the things that the cells are in. And in the dermis, also collagens and elastins. Now, collagen is the family of proteins that gives the skin its toughness. And elastin is something that, just as the name implies, gives an elastic quality to the skin. And these are the things that are damaged by ultraviolet light, and the things that, in many ways, this damage is what causes wrinkles and lines in the skin. So what are the clinical manifestations? Well, dyschromia, which is irregular color, brown spots. Telangiectasias are sort of those little red lines, those little enlarged capillaries that people often call broken blood vessels. Skin sags, it becomes thinner, becomes more fragile. Senile purpura, I hate that word senile. I like to call it actinic, meaning sunlight exposed, actinic purpura. But those are the sort of the easy bruising that you'll often see in people my age and older who will easily bruise, often on the forearms, often on the lower legs, areas that have seen a lot of sunlight. Benign neoplasms also occur in older skin. Um, not everybody, but the vast majority of human beings develop these rough brown things called seborrheic keratoses. Seborrheic keratoses are interesting. Some people have hundreds of them. And although they're benign, you have to, when you examine people, you have to be careful not to miss that little melanoma in this ocean of seborrheic keratoses. Sebaceous hyperplasia are little yellow bumps that occur usually on the face. They're an enlargement of the oil glands around hair follicles. Not important, but sometimes they can look like a basal cell carcinoma. And then cherry angiomas are these little bright red bumps and flat areas that people get all over their body, common on the trunk and extremities. Harmless, but a sign of getting a little older. And then, of course, skin cancers tend to occur much more commonly in aged skin and in older people. Now, we recognize two types of aging of the skin. One is intrinsic aging. This is due to protein and cellular changes that just occur as the years go by. This is not caused by extrinsic things like sunlight or pollution. But this represents only a small part of what recognizes aging of the skin. Most of what we recognize as older looking skin is extrinsic aging. And extrinsic aging is due to outside influences on the skin. And of course, the most significant one is environmental ultraviolet radiation from the sun. Other outside influences can also negatively impact the skin and cause things that we recognize as aging. Not as important generally as ultraviolet light, but plays a role. So intrinsic aging, I'm not going to go through this whole list, but again, this is something that just happens as we get older and as the years go by. The top layer of the epidermis thins, we get more senescent cells, cells that are starting to dysfunction, getting older. Decreased production of procollagen 1, which is cleaved into collagen, and the degeneration of collagen, elastin, as we talked about, happens from ultraviolet light. Mechanical effects of all muscle contractions, gravity pulling on the skin over years. Interestingly, another thing that is significant, more significant in causing visible aging of the skin is loss of subcutaneous fat tissue, and also some loss of substance of facial bones, and that gives sort of this hollowed out effect on the cheeks that we recognize as part of the aging process. But extrinsic aging is most of what causes most of what we recognize. Again, UVB radiation, we talked about it. It induces DNA damage and inflammation. It induces radical oxygen species, which initiate a cascade which causes the production and activation of what are called matrix metalloproteinases. These are enzymes that degrade collagen and elastin. They degrade what is giving the skin its strength, and this leads to wrinkle and line formation. And UVB does not penetrate very deeply. It's mostly in the epidermis. A little might get into the dermis. The UVA radiation, which I said is less important for cancer, but it penetrates more deeply. These longer wavelengths penetrate more deeply into the dermis. And UVA radiation also induces radical oxygen species, which initiate matrix metalloproteinase formation and activation. So UVA is really important, penetrates deeply. There's a lot of it. It's really important for aging of the skin. Interestingly, there's some evidence that visible light can play a role in some of what we recognize as aging of the skin. It can result in activation of some matrix metalloproteins. Blue light, which is the higher energy photons in the visible spectrum, can also generate some free radicals. It slows growth of keratinocytes, the main cell in the epidermis. It also can stimulate pigment formation and may partially explain why blue light can make dark spots darker or help create them. I said there are other things in the environment that can be associated with extrinsic aging. Exposure to air pollution is associated with, and ozone associated pigment, spot, and wrinkle formation. It appears that preliminary evidence suggests that at least some of these effects may be mediated by something called the aryl hydrocarbon receptor, which is on a lot of cells in the skin. I think I did not put this on a slide, but something else very important is smoking. And I think that this was accidentally left off, but it seems fairly clear that smoking also contributes to aging of the skin and wrinkle formation. Partially, this is from the repetitive muscle contractions of smoking, but also chemicals in smoke will contribute to radical oxygen species formation and degradation of collagen. So you really shouldn't smoke, and I apologize that this was not on the slide. Many people also worry about psychological stress, and they think that their skin gets older if they have a lot of chronic stress. At the moment, there's no real convincing proof that this is true. It may turn out to be true, but I think it remains to be proven. There's something else I do want to mention, which is something called advanced glycation end products. These are products in the skin caused by binding of sugar molecules to to proteins in the dermis, including collagen and elastin. And these molecules may not function normally when they're bound to the sugar. They become stiff. Glycolated elastin fibers can aggregate, and they interact abnormally with other proteins, including lysozyme, which is a natural mammalian antibiotic, kills microorganisms that's in our skin. And so these also are believed, and there's evidence that they contribute to aging of the skin. the glycated collagen is resistant to being uh, degraded by the matrix metalloproteinase and accumulate. But this is not normal collagen. It's stiff. Also, these glycated molecules may induce inflammatory signal pathways by binding to cell surface receptors on macrophages that are activated and release inflammatory mediators. And also, these macrophages can generate radical oxygen species. Keratinocytes, again, that the main cell in the epidermis, the upper layer, and fibroblasts, which are the cells in the dermis that are producing collagen and elastin, these also have receptors for these glycated molecules. So it's pretty good evidence that these are things we want to avoid. And although when we have eat a lot of sugar, we have a lot of sugar in our body, these are formed. Um, as I'll talk about in a little while, you can also be eating things that have these products in them. And although they're not, they can travel to the skin and other places in the body where they again can be binding to receptors on cells in the skin and contribute also perhaps to aging of the skin. I want to show a little bit of what it looks like through the microscope to look at some of these things. So this is a section of human breast skin from a young person. And this looks really very normal. You've got the epidermis, you've got the dermis. This is what it's supposed to look like under the microscope when it's stained properly. This shows some breast skin, but from an older person. Now, the breast in our culture is usually covered by 2 layers of cloth, so this has not been exposed to a lot of ultraviolet radiation. You can see it's a little different. The epidermis is thinner. Dermis looks different. You've got some aggregation of collagen, these larger areas, but doesn't look too bad. Now, the cheek, though, the cheek is an area that's exposed to sunlight a lot through a lifetime. Look how different this looks. Look at the collagen. The staining is different. The organization is different. This is photo-aged skin. Again, you have a very thin epidermis, a little, but the dermis is really different. So this is proof that the sun-exposed area of skin really are affected compared to non-sun exposed areas. So what do we do about this? Well, there are a number of non-surgical treatments. Antioxidants and carotenoids. Again, many cosmetic preparations contain them. There is some evidence that that even giving some of these systemically can be useful. I'm going to talk about that. And these antioxidants may not only help to prevent further damage, but may even repair damage. And this could be because as they inhibit the actions of oxidative metabolites, radical oxygen species that are doing bad things, collagen is constantly being produced also, and it may be changing the balance between degradation of collagen and perhaps elastin and its synthesis. And so things can actually get better. Retinoids are a class of molecules that endogenously are important in development, but artificial retinoids can be applied to the skin and have some beneficial effect. These retinoids, and I'll talk, I think I have another slide on this, which can help to cause some increased collagen production. Alpha hydroxy acids, things like glycolic acid, certain other hydroxy acids are also have some small effect on improving the skin. And those are also often in cosmetic preparations or over-the-counter preparation, I should say, not cosmetic. And retinoids, some weak retinoids can also be found in serums and creams that are marketed. You'll also hear a lot about various peptides and peptides that can stimulate collagen production and improve the skin. When they're applied topically, there's always a question of whether they penetrate in enough to do something. And of course, the companies that market these, I guess, believe that they do. A lot of the published data on these various peptides tends to be in dishes where they don't have to get into a skin. There's just cells in a dish. Um, and so often there is not published data on what some of these peptides do when applied to human skin, whether they penetrate. So I can't say. Um, there is some evidence that giving some peptides systemically can be useful. I'll talk about that in a minute. So what are carotenoids? I said they're anti-inflammatory. These are naturally occurring plant pigments. They have many biologic properties. They're antioxidants. Most are anti-inflammatory. Some are actually precursors to vitamin A. And Keratin, for instance, is. And it is probably correct that these have beneficial effects on the skin. Now I'm going to talk a little bit about lycopene. Lycopene is from tomatoes. It's what largely makes tomatoes red. It quenches free radicals in radical oxygen species, and it inhibits, and thus inhibits, activation of matrix metalloproteinases. It's anti-inflammatory. Interestingly, tomatoes also contain something called phytoene and something called phytofluene. These are precursors in the synthetic pathway of lycopene. And interestingly, they also absorb photons in the ultraviolet range. So they actually may even act a little bit as a sunscreen. Studies have shown that tomato extracts containing these factors given orally to humans can reduce redness induced by ultraviolet radiation. And these experiments were done with what's called a solar simulator, which has UVB and UVA in the same sort of ratios that natural sunlight does. And importantly, it's shown that it can inhibit gene expression for a number of inflammatory proteins induced by UVA1 and UVB radiation. There's another thing, carnosic acid, which is a naturally occurring substance found in rosemary and sage. This substance also has antioxidant and anti-inflammatory properties. And this next paragraph, I think, gives some very important data. There was a study done in which humans were ingesting a formula that contained lycopene, phytoene, phytofluene from tomatoes, a little bit of beta carotene, some tocopherols, which are things sort of related to vitamin E or our vitamin E, and some carnosic acid. These people had a significant reduction in their deep wrinkles and fine lines on the face. They also had reduced roughness and increased skin firmness compared to a control group that was not ingesting the active materials. So this is really amazing. I mean, there was a time when most people wouldn't have believed this, but just ingesting these sort of plant-derived things, harmless things, more or less harmless anyway, really improved skin. Now, hyaluronic acid is another thing that you probably have heard a lot about. Orally administered hyaluronic acid has been shown in many studies to increase skin moisture levels, and it also reportedly improves skin barrier function. Interestingly, and again, this is something that before these experiments were done, I think most dermatologists wouldn't have believed, it also has been reported to beneficially affect facial wrinkles. Something that's really interesting about this is that when you take hyaluronic acid orally, it's probably broken down in the intestines, but it's fragments that are absorbed that must travel to the skin and have their biologic effects there. It's really, really very interesting. Now, I want to get back to peptides. So as I mentioned, a variety of proprietary peptides are marketed for topical application to the skin, and they're said to have beneficial anti-aging properties. And a number of these have been shown to stimulate collagen production in cells in vitro. That's in a dish in a laboratory. Some of them have limited clinical experiments, but many of them have no published data. Interestingly, collagen peptides. Remember, we've talked a lot about collagen, how it's a major structural protein of the skin. But if that's broken into small peptides, it's been shown that um, uh, these collagen peptides derived from a variety of sources have been reported to have beneficial effects on aged skin, including lines and wrinkles when administered orally. Other topical agents, we talked about retinoids. Uh, 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 Topical retinoids do stimulate collagen production and improve the appearance of aged skin. It also appears they have a beneficial effect on the dyschromia, the color, brown colorations that we don't want on the skin. And as I mentioned, the alpha hydroxy acid and also beta hydroxy acid appears to have some beneficial effect. Um, it turns out that there are a number of other agents that have been reported, most of them antioxidants, polyphenols, carotenoids, vitamins, but also other agents that have been reported to improve skin health and skin aging. I'm not going to talk about any of these. There are a large variety of things that have been reported, but how well they work, I think, remains to be seen. Also, and I'm sure that people listening to this know, but there are a variety of surgical approaches, directed energy devices like lasers, um, uh, uh, injectable tissues, injectable fat, synthetic fillers, hyaluronic acid, neuromodulators like botulinum toxin, and other agents for treatment of the signs of aging of the skin. And many of these actually are quite useful. Uh, but I think a discussion of these procedural options is beyond the scope of today's talk. So I'm coming to the end. How do we prevent all these things? Well, one is, as I mentioned before, try to limit sun exposure, use sunscreens religiously. Do not smoke. Again, I didn't have that on my earlier slide, which was just an error, but don't smoke. And avoid sugars and grilled, fried, and roasted food. And the reason for doing this is that these have the preformed glycated molecules in them. And so you want to, even though they're not being formed in the skin, they can be absorbed. They will travel to the skin where they can induce inflammation and bind to receptors on skin cells. And with that, I hope that people have enjoyed what I had to say and have learned something about taking care of the skin and even what the skin does and why we have skin. So with that, I will conclude and turn the program over to Whitney. Thank you very much for your attention.
Thank you so much, Dr. Granstein. There is a lot for us to get into, definitely in the Q&A later. So thank you for everyone who submitted a question. Please continue to submit questions now in the chat and then as you're following up via email. On this sunny note, I have a few additional things to share with everyone. I think it's perhaps perfect that, we're closing out summer when people are barbecuing and eating some of these grilled foods and whatnot, and sugar. Definitely, that's a guilty pleasure for me. So I'm gonna have to watch that, not just for my overall health, but also for the health of my skin. So thank you so much. If you could advance to the next slide, just a few more things that we wanted to share with everyone before we close out today's webinar. Dr. Granstein talked a lot about some ingredients that are actually in Elysium products. So first he discussed NR-NPT in a mouse model, which was shown to be effective in mitigating some of the effects of sun exposure. So just a quick reminder there on the ingredients and basis and the exciting synergy that was shown in particular in response in terms of the ear swelling. That is just so amazing to me. We have that clinical paper, if anyone wants to dig into that a bit deeper, very technical stuff there. And then at the end, Dr. Granstein was talking quite a bit about some ingredients in the phytonutrient carotenoid complex in Mosaic. You see the components there, lycopene, phytoene, phytofluene, tocopherols, carnosic acid, the rosemary leaf extract, and hyaluronic acid as well, all in Mosaic, which, as I mentioned at the top of the talk, we launched about 2 years ago, incredibly popular product. Combining these two uh, may have these two products rather, basis and mosaic may have some synergistic benefits. Of course, we haven't done that experiment yet, but may have some synergistic benefits in the skin. And then if you could advance to that last slide, Dr. Granstein, or second to last, yeah. So here are some of the benefits associated with these ingredients, some of the things that Dr. Granstein covered today, just to revisit that for everyone. Um, and then the final slide is just a quick reminder that if you aren't able to submit a question in the chat today, if you'd like to follow up via email, you can certainly email us at events@elysiumhealth.com to ask your question. And as I mentioned, we'll be following up with an email after the webinar to prompt you to submit any additional questions. I'm very excited for this Q&A. I hope everyone enjoyed the webinar today. Thank you so much, Dr. Granstein. Thank you everyone for attending, and we'll see you at the next webinar.